Hello, welcome again to the Platinum Mensa podcast and YouTube channel. My name is Dr. Adewale. Thank you very much for watching and thank you for listening. If you have previously subscribed, thanks for doing so. If you've not done so, please do so now. As we conclude the month of June, which is Men's Health Awareness Month, I've discussed some topics that's pertinent to us men that we need to pay attention to prevent us from having a life altering diagnosis. Today, I want to focus on two topics, but for the sake of time, they will be done in two segments. The first topic is colorectal cancer. And why is this important? Colorectal cancer is one of those cancers that, if it's identified early, your prognosis is pretty good. However, we see much younger men being diagnosed with colorectal cancer. So, what is colorectal cancer? Basically, it's a cancer of the large bowel, often referred to as the colon. And what are the risk factors for colorectal cancer? Family history is number one, age is number two, lack of consumption of high fiber diet, excessive consumption of alcohol and tobacco products, lack of exercise, or history of irritable or inflammatory bowel disease. All these factors predisposes you to developing colorectal cancer. So if you fall in this category, please pay attention to your body. Watch the pattern of your bowel. And if you're having any abdominal discomfort, pay attention to it. What are the signs and symptoms that you may exhibit if you may be developing something in your bowel that may be related to colon cancer? You may be having abdominal discomfort that comes and goes and eventually become persistent and localized to your lower abdomen. You may see changes in the pattern of your stool and the consistency of the stool itself that may go from constipation to diarrhea. And at the same time, you may start seeing hard stool that's thin and pencil-like that may come out with pain. You may see blood in your stool. You may have excessive weakness due to anemia secondary to slow loss of blood in your stool. And you may just be fatigued. So when you see these signs or when you notice the symptoms, please seek the guidance of a doctor. The fact that age over 50 is a risk factor, we are seeing much younger men diagnosed with colorectal cancer. And this is actually worse for us as men because a man under 40 diagnosed with colorectal cancer has a worse survival when compared to our female counterpart. And the reason why this occurs is the fact that men procrastinate. We ignore the symptoms. We try to wish the symptoms would go away instead of seeking the guidance of a doctor. That's why when younger men or men are diagnosed with colorectal cancer, most of the time they have a later stage colorectal cancer that has a worse prognosis. So the goal is if you will develop colorectal cancer, have it diagnosed early so that we can treat it effectively. So get your routine colonoscopy done. If you're a man over 35 years old that have a risk factor that includes family history of colorectal cancer, it's incumbent upon you to get your routine colonoscopy done. If you're a man over 40, despite the fact that the recommendation says men over 50 should get a colonoscopy, if you're over 40, get a colonoscopy done. Get a baseline colonoscopy so that you know where you are. If there are polyps there that could be identified and excised and deemed to be precancerous, we have effective treatment for this. There's no reason for you as a man to die in this age from late stage colorectal cancer. So pay attention to the signs and symptoms. Pay attention to your body. And if you see any of those signs and symptoms or you have the risk factors, seek the guidance of your doctor so they can refer you to the gastroenterologist to perform the diagnostic test required. Pay heed, listen to your body. Like I always say, prevention is better than cure. Until next time, where I discuss in the next segment, prostate cancer. Stay tuned. My name is Dr. Adewale. Thanks for watching and thanks for listening.